5 medical checkups many Japanese seniors avoid after 70, and why less testing often leads to better health. In Japan, aging is viewed differently. Getting older does not mean chasing every possible test. It means protecting independence, clarity, and quality of life. Yet even in Japan, more seniors are beginning to follow Western-style medicine. More scans, more screenings, more procedures. And here is the quiet truth. After the age of 70, some routine medical checkups may do more harm than good. Japanese geriatric researchers have found that excessive testing often leads to unnecessary treatments, anxiety and loss of confidence, complications that reduce independence. Today, we will explore 5 medical checkups many Japanese doctors carefully limit or avoid in adults over 70, and why restraint is sometimes the healthiest choice. Everything you are about to hear is based on medical research and Japan's long-standing philosophy of minimal intervention. Let's begin. Checkup number 5. Bone density scans in healthy seniors. Bone scans sound harmless. A quick test, no pain, no recovery. But in Japan, many geriatric specialists approach these scans with caution after age 70. Bone density naturally declines with age. This is not a disease, it is biology. In older Japanese adults who have no history of falls, no fractures, good balance and mobility, a bone scan often leads to overdiagnosis, not protection. Mild bone thinning is frequently labeled as a problem, and medication is prescribed immediately. But these drugs can cause digestive irritation, jawbone complications, and unusual fractures over time. Japanese studies have shown that in seniors with mild bone loss, medication changes fracture risk very little, while lifestyle changes reduce risk far more. That is why Japanese doctors often prioritize resistance exercises, balance training, vitamin D optimization, traditional calcium-rich foods. Strength, not fear, protects bones. Checkup number 4. Brain scans for mild memory changes. In Japan, memory is respected, not feared. Forgetting names occasionally or misplacing items is considered a normal part of aging. Yet many seniors are sent for brain imaging too quickly. MRIs often reveal age-related changes that look alarming but mean very little. White spots, mild shrinkage, normal aging patterns. But once seen, they trigger worry. More tests follow. Confidence drops. Independence suffers. Japanese neurologists emphasize that structure does not equal function. Unless there are serious warning signs, such as seizures, rapid decline, or personality changes, a brain scan rarely improves care. Instead, Japanese clinics rely on simple cognitive assessments, sleep evaluation, nutrition review, stress reduction. In many cases, reassurance is the best medicine. Checkup number 3. Cardiac stress testing without clear symptoms. Japanese medicine strongly believes in context. Testing is only useful when symptoms clearly justify it. After 70, cardiac stress tests often produce false alarms. The aging heart responds differently to exertion. Results can appear abnormal even when arteries are stable. These results often lead to invasive procedures that carry real risk: bleeding, kidney strain, long recovery periods. Japanese cardiology guidelines stress this principle. Treat the patient, not the image. If a senior walks comfortably, has no chest pain with activity, maintains stable energy, then aggressive cardiac testing may create problems where none existed. Gentler options like resting heart rhythm checks or lifestyle monitoring are often preferred. Checkup number 2. Colonoscopy in advanced age. In Japan, screening always considers life stage. Colonoscopy is an important tool, but not forever. After the mid-70s, risks rise sharply. Dehydration from preparation, sedation-related confusion, bowel injury. Japanese data shows that in older adults with prior normal screenings and no symptoms, the chance of harm often outweighs the chance of benefit. Many small colon findings grow slowly and may never cause harm in a lifetime. That is why Japanese doctors frequently switch to stool-based testing, symptom-guided evaluation. Less invasive, less risk, more respect for the aging body. Checkup number 1. Full body CT scans. This is the test Japanese experts are most concerned about. Full body CT scans are heavily marketed as peace of mind, but in reality, they deliver high radiation exposure and uncover countless harmless findings. Tiny nodules, benign cysts, normal age-related changes. Once discovered, they lead to repeated scans, biopsies, surgical complications. Japanese radiology societies strongly advise against full-body scanning in people without symptoms. There is no evidence it improves survival, but there is strong evidence it increases fear, intervention, and harm. In Japan, imaging is targeted, not exploratory. Doctors ask, why are we scanning? What decision will this change? What risk are we creating? Japan's philosophy of healthy aging. Japan does not pursue medicine aggressively. It practices medicine wisely. The goal after 70 is not to find every abnormality. It is to preserve mobility, clarity, independence. Sometimes less testing means more life. Final message. Modern medicine is powerful, but power without restraint causes damage. If you are over 70, ask one simple question before any test. What happens next if this finds something? If the answer leads only to uncertainty, risk, or fear, pause. In Japan, true prevention comes from daily movement, balanced nutrition, strong social connection, mindful medical decisions. Choose tests carefully. Choose health wisely. Thank you for listening.